whole milk. And it's probably right here. Okay. This is a cup of whole milk, and this is a cup of skim milk. This is why we recommend skim milk. So I show these to my patients. I show them the sugar ones. I had a man that came in and said, you know, I drink a 12-pack of Dr. Pepper a day. When I showed him, and he says, and I don't know why I can't get my sugars under control. When I showed him this, I said, you drink 12 of these a day. Well, he's down to 0. He's on a pump, and he's well controlled. But he had a hemoglobin A1C of 15. Walked around doing this because his vision was always blurred. You think about the danger of what this does to us. Diabetes is not an easy disease to manage, folks. But the most important way to manage it truly is lifestyle, truly is exercising, moving, eating right, getting those fruits and vegetables in. Now, when we talk about fruits, we talk about a little apple, not the apple on steroids at Albertsons, okay? This is something I tell my patients all the time. You look at your fruit sizes. I was teaching a class in Delta, Colorado last week, and one man says, well, I eat 2 bananas, 2 apples, and 2 oranges every day for breakfast. I'm doing fine. I said, what are your sugars? He goes, well, I think the doctor said the last time was 13.1. It had come down. 13.1. Hemoglobin A1C, I says. He goes, yeah. And it had come down. What was it before? And he goes, I think it was in the 16s. And I said, and you're alive, huh? Okay. I said, 13.1 isn't good. And I asked him, has your doctor told you what normal is? And what is a normal hemoglobin A1C? Anybody know? 4 to 6. What should a diabetic's hemoglobin A1C be? About the same. Why should they be different from a non-diabetic? It should be, that's a normal blood sugar. It should be the same. I run 5.8 or less. You know, I tell my patients, I want you 6 or under. I don't even do 6.5. As long as they're not crashing and they're not roller coastering, they can maintain at a 6 or below relatively easily. It's when they roller coaster, when they eat and they diet and they eat and they diet, that they do the up and down, up and down. But if we can maintain them, there's no reason for them not to be at a 5.5, 5.6, 5.7. I wouldn't recommend a 4 put to them because they do have diabetes, but there's no reason to keep them at 5.5, between 5.5 and 6.5. None at all. Any questions before we go on?
Now, for questions, we're going to use the microphone. Otherwise, we don't pick it up on the machine there. So, yeah, we going off mute. Okay. Any questions?
And I won't tape anyone. just have an audio.
Is there a good diabetic cookbook that you could recommend?
I use many cookbooks. I have about 400 of them.
Wow.
There are, because I do a lot of teaching. But what's the best diet? What diet is the best diet out there? Does anybody know?
Balanced diet?
The diet you can stick to. It's the diet you can stick to. And it helps you lose weight. There is no magic diet out there. It's healthy eating. That's what is important, creating those balances, making sure you have enough servings of vegetables every day to give you the nutrients, the fiber. Think of what fiber does. It's the rotor-rooter of your blood vessels. It keeps them clean. So when they ask me which is the best diet, I always say the diet you can stick to.
So if my uncle's pre-diabetic and he doesn't really like many meats other than, beef, as long as he's sticking to a pretty balanced diet.
If he's
other than that,
including
he's
his
losing weight
vegetables and he's cutting the fat off his beef,
Yeah.
he should do fine.
Okay, good. Because that's what he was wondering.
I would encourage the fish, the chicken.
He hates fish, but he is adding in more chicken.
But if we can, the best we can do, and there's not going to be anybody out there that's going to eat a perfect meal. I don't eat a perfect meal. What I do is I do try to create balance. But if you don't think I cheat, think again. I'm human.
Such thing as a perfect meal?
It's a balanced meal. The perfect meal is making sure you've got enough vegetables on there, small amount of protein, 2 to 3 ounces, not Outback's 10, 12, 16-ounce steaks. We're talking to a deck of cards is the size of protein you should be getting. Okay, 3 eggs a week, not a carton a day. Because I know patients that'll eat 6 to 7 to 8 eggs a day. That's normal for them. So I tell them 3 eggs a week will keep your cholesterol levels down. Plenty of fruits and vegetables and fiber. Nuts. Include nuts there as long as you're not allergic to them. Walking. I also tell my patients an aspirin a day. A baby aspirin a day is very, very important for people with diabetes. You want to keep your blood flowing. You don't want to risk a stroke. You don't want to build a clot. So you work. You don't want to go from here to here. This is what we're talking about when we do this. Any other questions?
I have a question, Elaine. One of the things I read in the book about tightly controlled diabetes is there's still a pretty big risk of hypoglycemia.
With the older folks, people above 60. People my age, no, very rare. And the reason is, as you get older and the longer you have diabetes, remember what I said about the neuropathy? You start to develop hypoglycemia unawareness. You don't feel those sensations. You don't get those nervous feelings. So we do, and that's why I'm such an advocate for pump therapy as opposed to multiple daily injections. With pump therapy, you can monitor exactly what you're getting every day, all day long, 24 hours a day. And now with the new continuous glucose monitors that are coming on board, that's even better because it's going to alert you to a high. It's going to alert you to a low. That's why we advocate for 7 times a day checking so that you are aware. If you don't check your blood sugars, how do you know what they're doing? Okay, you go have breakfast. You didn't check when you got up. You don't know what the level is. So how do you know how much you can eat or if you should take something for it before you eat? You don't. Let me ask you, if you have diabetes and you feel good, you're all right? You're doing okay? Not necessarily. People learn to live with high blood sugars and not recognize symptoms. More often than not, patients come to me because they're tired, not because they have diabetes. They just say, I have a hard time waking up in the morning. I think I'm depressed. I'm always tired. I can't play with my kids. I can't walk as far as I used to. We do a hemoglobin A1C or a fasting glucose or random glucose and bingo. We know they've got diabetes. There's where their fatigue is coming from. Women come in with urinary tract infections or yeast infections. Men, balanitis. Not uncommon. And they say, I can't get it to heal. I'm doing everything. My girlfriend's being treated, I'm being treated, but I'm not getting better. It's diabetes. Or I have a cut that, I did this 3 months ago, and it's still open. It's not infected, but it's still open. So these are people I'm going to look at very, very closely. I had a man that had a massive toe ulcer. His was right here, and then he had a huge heel ulcer. And I said to him, how long have you had diabetes? And he looks at me and goes, I'm not diabetic. I said, those ulcers tell me you are. He says, no, I'm not. I've never been told I'm diabetic. I called his primary care provider and said, could you send me his labs for the last 2 years? Every 6 months for the last 2 years, he had had blood sugars of over 250.
Wow.
When I asked his provider why he hadn't been treated for his diabetes, he said, well, we're watching it. And I said, till when? You bury him? And he was upset with me, but I had to be blunt because this was a man that was about to lose a foot. We managed to heal the heel ulcer in the office, but I had to send him to the wound center for hyperbarics for the great toe.